Pathophysiology Unit 1 Part 4 Practice Questions. You ready? Let's begin. Which protein is essential in helping maintain fluid balance in patients dealing with edema? A. Albumin. B. Collagen. C. Hemoglobin. D. Myosin. 5 seconds. Correct answer. A. Albumin. Albumin is a major plasma protein that plays a key role in maintaining osmotic pressure, which is essential for fluid balance. It helps draw water back into the blood vessels from the surrounding tissues, preventing edema. A diabetic patient is experiencing rapid, deep breathing along with headache and fatigue. Which of these conditions is likely causing these symptoms? A. Metabolic alkalosis. B. Metabolic acidosis. C. Respiratory alkalosis. D. Respiratory acidosis. 5 seconds. Correct answer. B. Metabolic acidosis. Rapid, deep breathing, small respiration, is a compensatory mechanism for metabolic acidosis, often seen in diabetic ketoacidosis, DKA. The body is trying to expel CO2, which is acidic, to compensate for the acidosis, and the symptoms, headache, fatigue, are commonly associated with the condition. How to identify acid-base disorders in a practical way? First, ask yourself, is it respiratory or metabolic? It's respiratory if it's lung-related. It's metabolic if it's not lung-related. Next, acid-base patterns. In metabolic disorders, acid and base move in the same direction. Example, if bicarbonate is low, pH will also be low. The arrows point in the same direction, both low. Then, just determine if the pH is acidic or alkalotic. In respiratory disorders, acid and base move in opposite directions. Example, if carbon dioxide is low, pH will be high. You'll see the arrows point in opposite directions. Let's try to answer the question again. It's a diabetic patient, so diabetes is not lung-related. Therefore, we already know this is metabolic. Respiratory is ruled out. There's another clue in the question: rapid, deep breathing. This means the body is trying to expel more carbon dioxide, so the body will have low carbon dioxide. Since we know that metabolic follow the same arrow pattern, acid and base move in the same direction, low carbon dioxide will be followed by low pH and low bicarbonate. How do I determine if it's acidosis or alkalosis? I check either the pH or the bicarbonate, hydrogen carbonate, levels. Here, we have low pH, which indicates acidosis. So, we've already determined that this is metabolic acidosis based on the first and second steps. Even if the answer choice isn't explicitly listed, we can confidently conclude the answer is metabolic acidosis. Okay, next question. During acute acidosis, which electrolyte moves from inside the cells to the extracellular space to help balance the electrical charge? A. Potassium. B. Albumin. C. Calcium. D. Sodium. 5 seconds. Correct answer. A. Potassium. Remember, potassium in, sodium out. That's how it usually works inside the cell. However, when there are changes in the body, like in acidosis, potassium shifts from inside the cells to the extracellular space. A patient is diagnosed with a rare autoimmune disorder, but despite extensive testing, the specific cause remains unknown. This type of disease is referred to as A. Iatrogenic. B. Nosocomial. C. Idiopathic. D. Congenital. 5 seconds. Correct answer. C. Idiopathic. An idiopathic is where the cause is unknown or unclear. A patient experiences a myocardial infarction, heart attack, due to prolonged ischemia. The primary cellular injury mechanism in this scenario is A. Direct physical trauma. B. Genetic mutation. C. Hypoxic cellular injury. D. Exposure to toxins. 25 seconds. Correct answer. C. Hypoxic cellular injury. A myocardial infarction is caused by prolonged ischemia, which leads to a lack of oxygen, hypoxia, in the heart tissue. Hypoxic injury disrupts cellular metabolism and function, leading to cell death if not reversed. Thank you for reviewing with me. Up next, Pathophysiology Practice Questions, Unit 1 Part 5,